Welcome to biceps tendonitis. So this is actually a relatively common diagnosis. Now, when you have shoulder pain, there's a lot of different things that can cause it. It could be muscles that are up higher in the shoulder, the rotator cuff muscles. We covered that last month. However, the biceps tendon, it could be flared up in a couple different locations. So we've got the biceps are here, okay, in the front of the arm, bi meaning two. So there's two biceps. One kind of attaches up here and the other attaches a little bit over. Now the bicep tendon comes down and then we've got this attachment here in the elbow as well. So you could have pain in either location. So it could be up higher or it could be down lower. Typically, if you have something going on with your biceps tendon, you're going to have pain when you're flexing your elbow. So that could be lifting up a bag, that could be holding your phone or tablet for an extended period with the elbow bent, and it's like, man, that arm aches. It could be when you have your arm out in front of you in an extended position as if you're reaching for a plate or a cup in a cabinet. Not overhead, but straight out in front of you. So those are all common things that could be flaring it up. Now, what to do about it? One, do not sleep with your elbow in a flexed position all night long. It causes that muscle to shorten and it's going to kind of keep it in that irritated state. So you want to, but you don't need it completely extended either. So you want to have the elbow kind of open. So one thing I tell patients is grab a hand towel from the bathroom, roll it up, and then put it right here in the crease of the elbow and gently use like an ace bandage to hold it in place. So it'll block you from not being able to bend that elbow too far. So that way at night, you won't be able to sleep in this curled up position. So that can really help. Other things that could help are just being able to work on that posture and not guarding that arm. I see this a lot with individuals when their bicep tendon hurts, is they walk around with their arm really guarded. You really want to try and make sure that you keep that arm open and extended as much as possible. So a way to do that is to try and put your pinky in your pocket. So if your pinky's in your pocket, then you're not having your elbow bent. So it's just like a little test for you. Another thing is to make sure that you're not doing repetitive activity that causes it to hurt. So you might need to use your other arm to lift something heavy or to be able to reach for something in a cabinet. Each time you reproduce the pain, it's just going to cause more inflammation. So different things to try. If that stuff doesn't work, then definitely seek the help of somebody that is trained to be able to evaluate biceps tendon pain. So when we're talking about elbows, there's a couple really key things to think about. We got to think about what's above the elbow and what's below the elbow. So what's above the elbow is the upper arm. So there's the muscles in the upper arm that include over here, where we've got some layers that we're going to start adding. So we've got biceps, we've got a muscle that sits underneath the biceps called the brachialis. We've got the muscles that sit on the back of the arm called the triceps. And so I'm going to kind of add a few more layers in. So see there, it's like there's a good amount of layers in there. Then we have to think about what's below the elbow, which is the forearm. So we've got muscles on one side of the forearm and they cause flexion of fingers and flexion of the wrist. And then we've got muscles on the other side of the forearm that causes extension of the fingers and extension of the wrist. So when we're thinking about elbow pain, really we've got to think about what could be going on with muscles in the forearm, muscles in the upper arm, as well as ligaments that support the elbow, and if there's any sort of potential issue with what we call the radial head, which is the end of a bone up there that articulates at the elbow. So stay tuned this month to learn more about different diagnoses and a couple little tips and tricks for maybe how you could help them. Now, tennis elbow does not mean that you have to be a tennis player to get it. This is actually a pretty common injury because the muscles in the forearm that you use that get overused are really common muscles that we use for grip-related activity. So that could be, vacuuming, it could be doing any sort of like ironing activity. Could be some sort of like extensive use of a keyboard, mouse, anything where you're using your muscles that cause your fingers to extend or your wrist to extend, and you're not balancing it with muscles on the other side of the forearm that cause wrist flexion. So meaning if you're doing an activity repetitively and your wrist is in extension for too long, then what that does is it overutilizes the muscles that attach right through here. And so when we call it a tendinitis, it just means that there's inflammation around the tendons that attach to the bone out here in the elbow. Now, there's more than one muscle, so it could be one muscle that's really irritated. Usually it's the group that kind of gets on the irritated side. So I'm going to add these layers as we go. So see, we've got a nice big grouping of muscles that cause the wrist to extend. So one thing to think about is if you're typing, okay, you don't want to type with your wrist in this extended position. You really want to type with the wrist in a neutral position, so more of like a floating over the keyboard. Same thing with using the mouse. If you're using a mouse and that wrist is in an extended position, that can really start to flare up the muscles in through here. So the mouse I use is a mouse where I actually have my hand is on the side of the mouse, which helps me balance the muscles that actually cause flexion. So it uses the other muscle group, so I'm not only using the extensor muscles. The other thing to think about is if you're doing a gripping related activity, it could be a tennis racket, it could be a golf club, it could be ironing, it could be vacuuming. You really want to make sure that you're actually closing in and gripping with as much of a neutral wrist as possible and not having that wrist in an extended position for any period of time. That may alone help to resolve your symptoms. If it doesn't, you might need to seek some help from somebody that can diagnose it and try a couple more things that might be more specific. There are some splints that you can get at the store to sleep in, and that just makes sure that at night you're not doing anything kind of silly with that wrist that's causing it to get irritated. So a couple things you can try, and if it doesn't work, seek some help. All right, stay tuned to learn more. Just like tennis elbow, it doesn't mean that you need to be a golfer to get this injury. What this injury entails is a flare-up of the tendons that attach the flexors, so the muscles on the front of your forearm that cause wrist and finger flexion. It's just a flare-up of those tendons. Why would they get flared up? Well, an overuse injury is typically what happens. So if we take a look here, these muscles come up and they attach more on the inside of the elbow, which is opposite of the muscles that attach out here, which is the tennis elbow. So I'm going to add some more muscles in so we can see this is a whole group of muscles. It's not just one. That's why they're able to have the complexity of controlling finger flexion as well as wrist flexion. Now, same thing as with tennis elbow. How do we try and get this to calm down as quickly as possible? One, making sure that you're not doing anything in a flexed position in an overused period. So it could be in a golf club, you might really be trying to over grip and really trying to hold too tight. Usually this is like you're really holding too tight. This can happen with tennis, any type of activity where you're holding that grip for an extended period. The other reason why this might happen is if at night, if you're sleeping with your wrist flexed and closed and holding it in this position, that can keep it kind of irritated. So one thing you can do is try getting an over-the-counter splint just to hold the wrist in a neutral position while you're sleeping. See if that helps it calm down a little bit. If it doesn't, you might need to seek some assistance from somebody that's trained to evaluate and diagnose elbow pain. Otherwise, you can try to use some of these conservative strategies. The other thing that you can try, other than changing your grip to make sure that you're gripping in what we call a neutral wrist position, so not a flexed position and not an extended position, but neutral, okay, is you can try some stretching to these muscles. So what the stretch looks like is you take your fingers and then you pull them back, making sure that you don't feel any pain in the wrist, but you feel a stretch in the muscles through here. So try stretching with the elbow bent and then as well with the elbow straight. Hold the stretch for 30 seconds, repeat it 2 to 3 times, and try that, maybe a couple times a day. So between that, changing the sleeping position, and then changing how you're gripping during the activity that's probably provoking it, may be just enough to try and get those symptoms to calm down.